later seasons with the zombie.
Hello.
Woo, we have Neecey. Hello, Dr.
What's
Hudson.
Hey, hello you.
Hi guys.
Welcome back. Welcome back.
Thanks
You're
for
just
having
gonna
me.
show up. You're just gonna show up with that cool ass gorilla sweatshirt.
Yeah. It's not just gorilla, it's public health gorillas.
Public health gorillas. I'm getting one of those for my mom because she's a public health gorilla.
Y'all
Get
really
one!
gonna appreciate,
Oh
Yeah.
my
y'all gonna
gosh.
appreciate that I have a problem. I have a real. It's getting ugly right now. I got shopping carts all over the internet full of stuff. I'm like, yo, dog, what's up? You know what I'm saying? You got that money. What's up, man? Why'd you get that done?
That's actually what happened with the Hood Medicine Initiative shop. I have like a cart that has about 20 different things in it, and I'm trying to reduce that down to something a little more reasonable.
Yeah.
Yeah, like I love the one with it's got like a zombie hand on the back.
Yes.
And it says if this were a zombie virus, you'd have eaten your whole family or something like that.
Yeah.
So great. So great.
Yeah, you missed that conversation last time, Randy.
I feel some kind of way like that.
Hey, you gotta keep it real.
Bro.
Yeah, what's the
you gotta meet them where they are, you know?
what's the address? Do people
sweatshirts, man?
do people just go to hoodmedicine.org, or where do people need to go in order to get to the merch if they want to? You can obviously like go and donate, but if you want to go and get to the merch.
Yeah, like if you go to our website, which is hoodmedicine.org, you can kind of see on our donate link all the places that you can donate, either through PayPal or you can use our Amazon Smile portal. And then all of our like t-shirts and sweatshirts, and we even have a couple masks now too. All of those are on Bonfire. So our store is just bonfire.com, and it's Gorilla Gear. That's the name of the store. So it's just bonfire.com/store/Gorilla Gear. So
And that is GUE, gorilla, not GOR, gorilla.
I am going to put it in the chat.
Thank you.
There you go. They're so awesome though. I love it. How are you guys doing?
Bamboo.
Good.
It's January 29th in the apocalypse. Things are going great.
It's not. Come on.
That is what I came to say tonight.
You know
I
what,
came
though?
with a message for humanity.
You know what though? It feels, for me personally, it feels a lot less apocalypse. It
Wait till
feels
we get-
like.
Let's talk about it at the end, and then you let me know what you think when I'm done.
I mean, I get it. Don't get twisted. It's still shitty,
Yeah.
but I feel like I'm only like.
Yeah. So
you
for,
know,
I guess I
I'm
don't
only
mean
knee-deep
like,
in shit,
yeah.
in
I
shit
guess I
as
don't-
opposed to hip deep.
I guess I don't mean like abandon all hope, but like, yeah, abandon all hope. Yes, I do mean that, but not to despair.
well, just
Now is the time that we need to band together and remember the connections between us. And
that's dope.
So what you're
Live and
saying
love.
is
Before we get
there's
too much,
no time for enemies.
I just want to say,
no, yes.
Is that what you're saying?
wasn't tuned in for your last appearance with us. Can we just recap and you can give your a quick intro to your story and what
I
you
would love to. Yeah. So Hood Medicine is a nonprofit public health collective, and it's made up of like scientists, hackers, and a bunch of other geeks, Dolio included. He's our resident hacker. Sleeves is our technical consultant. And we are just, dedicated to protecting Black and brown lives. We realized that in the beginning, what was really at stake, and obviously we went a whole year letting the virus get the better of us because of, just the failed administration that we had. And now we have all that time to make up for, and all of that propaganda and disinformation to overcome.
Yes.
And we saw that that wasn't even happening on a national level, let alone for all of these like historically like underserved communities who already don't have access to healthcare or equitable healthcare for that matter. And so we just kind of looked at each other and we were like, somebody needs to do this for people in the hood. And we were like, well, we could do it. And so we did it. So that's kind of our origin story.
Yeah. Like, yo, we all we got.
Period.
Which is another shirt, by the way, in the Hood Medicine store.
They're so cool.
I got that on a pair of sneakers, man. Now I gotta get that to match my sneakers.
Oh, we have some cool new ones coming too. We have this new like gorilla logo, like gorilla, like literally, like it's like
cute.
Che Guevara or something. You know what I mean? It's really cool.
And Dr. Neecey, and how did you plug into Hood Medicine? You're on the doctor side of this?
Yeah, so I'm a research scientist and a computational biologist. And so I kind of, try to put together information for people. We do these chats to talk about sort of, on the one side, the sort of historical relevance and influence on the current reticence of several minority communities of getting the vaccine. We try to explain the science and the vaccines so that people can have the information that they need to have true understanding and make the right choice for their families. And so there's several of us in science and policy kind of. We have an environmental justice scientist who just came on. We also have a CDC epidemiologist who is also from MIT, and a public health advocate. And we have a community care worker who puts the Robin Hood in Hood Medicine out here in the streets, just doing everything. She's a true gorilla before, it's in her blood. And then we have a bunch of hackers and marketing people who are making my life so much easier. But yeah, so that's kind of who we are. And so I just really want to make sure that we do a good job of, trying to help people understand what's going on so they can keep their families safe. I kind of wanted to talk a lot about the mutants, as well as some of the just logistics of the vaccine rollout, so that to try to help alleviate some of the, confusion and some of the systems that are backlogged and crazy, and just try to give people a little bit more information.
Yes, please.
I might need to take care of something first. In your description, you said you're trying to help Black and brown people survive in this thing.
Mm-hmm.
I think, can I talk to my white people for a second out there? White? Okay, folks, that's a good idea, and you should care about it, because there's some particular challenges facing some communities, and we want everybody to get through this thing. But it's also in your interests, because if they don't survive, you're not going to survive. Okay, we're a chain that needs no weak links, so everybody's got to be on board with this. All right, now we can get back to the conversation.
Yeah, we've long served as the canaries in the coal mine.
Yeah, for sure.
Mm-hmm.
I thought that I might start with a review of the science, so that everything I have to say about the end of the world will make sense. So, by the way, I have a margarita because I feel like we probably need to set up a drinking game where I say, every time I say vaccine instead of virus, take a drink. It's a problem.
Yeah, there's the two V words. I've heard people saying that a lot.
It's
not just you. It's a really common thing.
Virus is a bad one.
Everybody use your common sense. You will understand. All good. Or take a drink.
So, here's what it is. So, we know that COVID is a coronavirus, right?
Yep.
And it is similar to a lot of viruses in that It's sort of just a little protein bubble. And I thought maybe I would share some of our really cool new sort of infographics as I'm explaining this, because that might help your understanding. Let's see. Sorry, I thought I had it up already. So anyway, it's a coronavirus is it's just like a lot of other viruses in that, you know, it has like a protein bubble. I'm gonna share my screen. Okay, can you guys see it?
Yes.
Yep.
Cool. All right, so COVID has a protein bubble, just like a lot of other viruses. Inside is just a little piece of RNA, which is a lot like DNA, but it's just like a single strand. And then outside are like the spike proteins that we hear about all the time, right? And that's how they get into your cells. And so the ACE2 receptor, you know, that we've heard about a lot is how it gets in. So it kind of locks onto that like a key in a lock. And then that receptor kind of turns inside, it flips itself inside of your cells, and that's how it comes inside, right? So we know that like ACE2, like we talked about last time, is found in your lungs, heart, brain, kidney, stomach, almost all of your tissues, really. So that's why there's like a lot of opportunities for it to like find other places to latch onto once it comes in through your nose and eyes and mouth or wherever else you caught it from, wherever you're doing out in the world, got no business doing. And so, you know, it's probably a big part of the reason why there's so many, just a myriad of complications in a lot of different organ systems with people who suffer from illness when they get infected, because it's everywhere. You know, you know, I say keys open doors, those doors are everywhere. You know what I mean? So once it's inside, when the like receptor just flips it in, right? It's a wrap. Once it's inside, it's going to take your copy machine, make its own copies, and then you're going to start making more and more and more and more viral particles to sneeze on everybody who doesn't have a mask on. So once it gets inside, it kind of dissolves that bubble, and then all its little RNA goes to your cells. You stop making the proteins and sending the cell signals and replicating your own genetic code, and you start replicating the virus instead. And the next thing you know, you're just a host factory. And so all these new viral particles come out of your cell and then out of your mouth and out of your nose, which you refuse to cover in the grocery store. And I guess that's the biggest sort of point of my mission right now, is to implore you to stop giving it hosts. Mm-hmm. We'll get to that. I'm getting ahead of myself. I'm getting ahead of myself. So here's the thing, right? Once it gets inside, it's a wrap, right? So it's able to replicate, and that's how we get to the mutations, right? Because our cells are a little bit more sophisticated than viral cells. Like I said, viruses are just like a little protein bubble with a little piece of DNA inside. They don't have cell machinery. They can't divide and grow the way that we do, the way animals do, the way plants do, in order to propagate themselves and keep living. They need hosts, which y'all keep giving it.
So hospitality was a good thing.
So like once we keep giving it hosts, that's how it's able to persist and survive, thanks to us. And so when our cells start, when it takes over our copy machine and our cells start making its copies, there's lots of chances for error, right? Like we mentioned last time, there's a gene editor that tries to correct some of those errors. And so it doesn't necessarily mutate as rapidly as some other viruses. However, effectively, it might as well be mutating as rapidly as HIV, because y'all keep giving it hosts to practice in. If it was just a normal thing like the flu, right, or something else, whatever, that does mutate a lot. You would think like literally it's not as unstable as those other viruses. It's not. But the effect, it might as well be, because there's so many people that keep giving it enough hosts to mutate within. It might as well mutate as rapidly as HIV. Thanks, guys. I'm sorry, this isn't gonna be a pleasant one this evening. Sorry. Damn the jokes. You know what I mean? Quit playing. So that's part of what's going on, is that if you think about, I think I need to be a little bit more succinct about what I meant last time, because I think sometimes people just like presume any disease or any virus or anything. We almost think about it like as like a amorphous kind of blob, like a monolith almost, that, like you get a virus and it's just, it mutates, almost like singular. We don't even think of it in terms of the multiplicity that is really involved. You know what I mean? Like, because when I say that y'all keep giving it hosts, what I mean is there are 7.8 billion people on this earth. You feel me? The entire globe is red. Thanks, guys. So you would think 7.8 billion chances to mutate. That's astronomical, right? That alone, the probability there alone, you would think would be enough, but obviously it's not. It's not, obviously. So I just wanted to make sure to put a fine point on it and make sure everybody understood that for every one of those 7.8 billion people, there are 37.2 trillion cells in every single person. I can't do math in my head anymore after going to MIT with Dolio. He knows, he might know. I need a calculator for everything. I can't even do math in my head anymore like that. But somebody on here got a calculator.
The answer to that is hella. That's how many that is.
Hella, yes.
Hella.
Right.
So
that's how many chances we've given it to mutate through our inability to manage our greed, to give a shit about other people in the world, to hold our leaders accountable. That is what we're looking at. 7.8 billion times 37.2 trillion. I mean, it's doing a dissertation on us right now is what's really happening. It started in bats. You feel me? That's where it did his bachelor's. Okay? Y'all letting it get a master's MD, PhD is what the virus is doing right now, thanks to y'all. This is what's happening. Because there are so many people in that 7.8 billion who still live in the dark ages because we refuse to feed everyone. There are incubators all over the world of people who will be forgotten, who are fighting to be able to even produce the vaccine right now because companies and all of our wonderful land of the free first world countries refuse to give up the patent so that everyone can make the vaccine. That's them chickens coming home to roost that Rench was talking about. You think we calling them people because you don't care about them, stacked up on top of each other in Brazil, pumping out mutations in shanties. We don't care about them. Let them die. Except y'all ain't closing the airport. Y'all ain't shutting the borders. Y'all still got money to bank. Guess what's coming? It's already here, boo. Ain't no mutation on this planet not coming here. Oh my God.
Yeah, and most of them are already here, and we don't even know that because we're not sequencing enough of the virus that we have to even know what all is here.
Period.
Yeah.
Period. In our minds, we already think let them die. That's why we throw away millions of pounds of cheeseburgers every day, and they starve to death. This is where chickens is gonna come home and get all of y'all. Because it's obvious that no one understands the concept of invisible particles. but they're not made up the way that money is. They're real. So it's burning through the population, right? Everybody. And so it's learning our weaknesses. And what they fear from some of the data that they have from people who've been sick is that it suggests that some of the variants are like propagating more readily in immunocompromised COVID patients because it's able to linger a little bit longer in their system and it gives it more opportunity to mutate, right? So here's the thing. There's a lot of things. Let's go through them all, okay? Let's talk about the UK strain. Let's start there. All of these are here. I can't reiterate that enough. But keep going to the club. Fuck it. I mean, who cares? They're all here.
That's why we're here on a Friday night in our houses.
Right.
That's right.
The UK strain, it has 23 mutations. 8 of those are in the spike protein that I just showed you, which is how it gets into the cells. So it's over here learning how to pick locks, and y'all in the club. Okay.
The lock picking analogy is a great one.
Yeah.
It's a really, really useful one. You know, you might have 1,000 mutations, 1,000 different people who are picking locks, but if 10 of those people are really good at it,
yeah,
then suddenly that's going to be your dominant strain.
Right.
Can I ask you a question
Yes,
about something
yeah.
that I've read? So what I read about the UK coronavirus, the new UK mutation, or variant rather, and also likely the South Africa variant, and presumably some of the other ones that we're picking up on, because there were so many mutations in the UK variant. The working hypothesis is that it has to do with not just an immunocompromised patient, although yes, an immunocompromised patient, but who would have gotten the antibody cocktail treatment, possibly also remdesivir, and that just not fully working in that patient, and that giving the room for these sort of resistant new variants to, a new variant to come about and then get spread around. And it's sort of like almost like the way antibiotics can create antibiotic resistant strains.
Yes.
And if people don't take the full course, they only give it enough to like slow it down, so now they can build up the defense against the thing that you were using to defend against it.
Yeah.
Right. Or maybe you even get multiple courses, but you're just so immunocompromised that you're less able to have those work in you.
And really, that's just an inference. Everything that I'm going to explain are things that we can infer from what we've seen before, until we get enough data to confirm it.
Yes.
That's just an example, like in that example of the immunocompromised patient, that's just an example of one of the many ways that it learns our weaknesses. You know what I mean? Like, if you think about 7.8 billion people, that's all of the immunocompromised. It's people with cancer, it's children, it's teenagers, the elderly, women, men, people with all kinds of diseases, everything. It is doing a dissertation on the human species, and you're helping it. You're its dissertation committee. So basically, so right now, I mean, that one, is sort of, they are inferring that it's more sort of infectious, and that's the sort of result of that. They don't necessarily think it's more lethal in the sense that the virus itself is causing more deaths. However, because more people keep getting sick, and there's only 2 places to go nowadays, apparently, the club or the hospital, more people are going to die because they can't be treated. There's not enough beds. So that's the issue, which we continue to ignore. Then there's the South African variant.
They just discovered that. I just heard about that on the day.
It's been a month or so.
Yeah, it's only been since December, I want to say. Everybody just had a Merry Christmas, So here's the thing. This one is a little scarier because it's changing the structure of the spike protein as well, but they've already kind of seen that it's or they presume that it's able to evade antibodies better. And they've confirmed that with blood tests. And so this one is scary because it kind of, it has the danger of being what they call like an escape mutant. And it's basically what you can imagine is that it can, you know, sort of, it finds ways to evade the vaccine-induced immunity or people's natural immunity by changing itself in a way so that the vaccine is no longer effective against it.
Zoinks.
And sorry?
Zoinks. Go on.
Yes, right, exactly. I'm glad that somebody has the appropriate level of concern for that. I'm going to share my screen again. I feel like I should have one of those little learning chimes, you know what I mean? Right? I just wrong one. Sorry. Something like that, right? Okay. So essentially, this one is about the vaccines. So here's what happens to start with, right? The spike protein, like I said, is the outside of that virus. It's how it gets inside. So it's essentially its calling card. It's the way that your immune system recognizes what it is. It's sort of it's what your antibodies are engineered to attach to. It's another key and lock scenario. You know what I mean? They match up. And so in a normal infection, right, your immune system checks the ID card, you know, and it's like, oh, it's this. And so they're like, guys, we need this kind of antibody, right? And then like go send them out. Then the antibodies basically tag it, right, for death. And then like down the line, an assassin comes along and it can see which cells are tagged and it just starts spraying, right? But with COVID, right, it's new to our species, and so we don't have any immunity towards it. And we don't have any sense, which is why the map is red. Both of those things together is why the map is red. We don't have immunity and we don't have any sense. So the beauty of this vaccine is that it takes that ID card, you know what I mean? And it gives your cell like a cheat code to figure out, like to tell everybody what, you know, the calling card of the virus is so that you can start making antibodies without having to get infected. Because if I hadn't made it explicitly clear, you should not want to get infected. You might die or have permanent organ damage. So the vaccine itself gives your cells a cheat code, and then you start producing that spike protein needed to make those matching antibodies so that they can fight off the infection. So then when you get that injection in your arm, it's the muscle cells that download that cheat code, and then they throw like a huge party on top of the cell, and everybody comes, and they're like, you know, okay, here's what COVID looks like. Please remember next time, because we're gonna have to kill it on site. And then that is how you kind of start to build your immunity towards it over time. Like,
a little party again.
Are you kidding? Yes, of course you can.
Yeah, you gotta show them.
It's pretty awesome.
Hey, look at those guys. They're rocking.
Yeah.
Let them go to the club. Y'all stay home.
There was definitely meetings.
Thank you, Austin.
Yes.
There was definitely
They're at
meetings
the
about
club.
the proper placement of the hat and which one should be wearing the hat.
Yes.
Who's going to be holding the sparklers and whatnot.
It was a part of our agenda in the meetings.
Yeah.
All right, so let me ask you a question.
Yes.
How would you go about explaining like everything that you just explained, right? How would you convince someone that's like super anti-vax that this is the right because a homie of mine like was like, yeah, don't get that vaccine. You know, they put that in you, right? Like, that's how. I was like, well, isn't that how they? Yeah, that's the thing. Like that's the thing.
That is the thing. Yeah, that's a good
I'm
point.
like, I felt like you're speaking to like-minded individuals here, right?
Mm-hmm.
So how would you like say the Hood Initiative is how are you guys like out on the streets like, all right, look, knuckleheads, like all of you guys that are like, you know, you guys are mad, you know, you're smart because you were on the internet and you saw, you know, Dr. So-and-so on YouTube saying that this, that, and the third. Well, no, this is the actual science. Like, how do you get somebody from one page to the other page? How do you get them to turn the page? Like, oh, this is the real thing. Not, you know, a guy that has
what do you say to the guy who says, like, you know, do your own research? This YouTube video.
The call of the
QAnon.
QAnon.
You know, lowercase doctors and so on and so forth. And, you know what I mean? Like how do you do that?
Well, part of it is being the fact that they have done their own research. You know, these are actual scientists.
Yeah. I mean, it's difficult. That's our biggest challenge because, you know, there's a lot of people who don't even believe it's real, and there's a lot of people who don't believe it's a real threat. That terrifies me. I'm so irritated with humanity right now because we're on the precipice. We are already probably past the point of no return.
Yeah.
And it's like the way that we're managing things.
Coconut scented with mango flavor.
Thanks, Dolly.
Now sounded
Cheering for the point of no
I
return.
was like, oh no, what did I do?
Say the secret word now.
Awesome.
The secret word was
I feel like I should drink behind that. Probably.
Yeah, that was definitely that was the time. I'm out of my drink. I actually got to go refill. Be right back.
Yeah, I guess that's why I kind of I lead with the doom and the gloom because that's the reality. As a scientist, what I want people to understand is that I'm not looking at y'all as like people. I am. Let's be clear. If I couldn't be any more clear about how irritated I am that no one cares about their fellow man. But I'm not looking at it like, oh, there's all these people to save, and that's the only imperative. It's also there are all these disease vectors in the world, all over the globe, turning it all red. And the only way to get that the only way that we're going to be able to mitigate that is that if we can convince people of the danger and get them vaccinated. And even now, I don't know if that's, I mean, y'all play too much, man. I mean, these variants, some of them, I mean, we don't even know if the vaccines, like they already talking about having to like make new boosters for the mutations. And we ain't even got a damn person vaccinated yet. You know what I mean? Like it's almost gonna be impossible almost to contain, which is why we are just like, we cannot rely on leaders. They don't care about anything or anyone besides money. And everyone's so like careful not to offend all the robber barons that they're gonna let us all perish, basically. And so we just want people to like take it seriously. So first, what I do is make sure they understand the stakes. There's been so much suppression of obviously the numbers, you know, the impact to our healthcare and hospital systems. Those are the things that we try to stress to people because I feel like people do think it's a joke. Like our next HeadMed chat panel is going to be with morticians, okay? Because it ain't a joke.
Yep.
There's not enough room for the bodies. That's what I need people to know. And so like when we try to talk to people about the vaccine, anyone who is hesitant or doesn't, or like naturally is like defensive about it, I literally just ask them what they understand about it. And then I start explaining it. Like, I don't feel like it's necessary to talk down to people or infantilize people. Like, I don't presume anybody is not on the level enough to get what I'm talking about. It's a simple concept. You understand locks and keys. You understand spit coming out of your mouth when you talk to people. These are simple concepts. It ain't even about science to me. Like, you know, when sometimes we try to play on the fact that Black people are natural germaphobes. You know what I mean? Like, we don't eat everybody's potato salad because not, you know what I mean? Like, we try to play on like all of that, like anything that we can grab onto.
Now that you mention it, though, I am canceling my RSVP to this Spit in Each Other's Mouths party.
Good.
That's good. That's good.
I'm glad somebody was able to convince you.
Yeah, we were trying to get him not to go. He was dead set on going.
Yep. Kept saying they were all in his bubble. They're all part of his extended bubble.
Yeah.
Yeah,
I mean, I don't honestly, I don't know. I don't honestly know, but we do feel like that where we've had success in convincing people of the urgency and the necessity of vaccination, especially people who are staunchly against it, the way that we've been able to give them over to the understanding is knowledge. People don't need props. They don't need mandates. They don't need commercials. I mean, we might need commercials. But like everything that we've been doing up until now is completely ineffective in case you hadn't noticed. You know, what would be nice is if people got the truth, the information that they needed, and could come to their own logical conclusion, of which there is only one.
Wait a minute. We had a whole bunch of weekly presidential press conferences every week way back last year.
More than weekly, freaking every day.
Time giving out some sort of information. Right?
That's right. Whatever happened to hydroxychloroquine? Just totally
honestly,
kidding.
I thought bleach was going to be the answer. I really did, but
I thought anal sunshine was going to do it.
This virus is tricky. Got past that bleach.
Listen, I spent a good $100,000 trying to develop UV suppositories, and it turns out they're not really a thing. So, yeah.
You just end up having to sit on an inflatable donut for a couple of weeks.
It was not a thing. It worked out.
Yeah, and the hydroxychloroquine got rid of my fin rot, but
Right, but the hallucinations were a little much.
Yeah.
All right,
And then
so I got
the bleach is why I don't have a whole arm right now. You see how far my arm's going? That's why.
Yeah. And for some reason, I have gills now, so there's that.
Come to DC. We can make use of gills. Shout out to Dan's live stream on Wednesday.
Yeah, that's my way into this conversation. Good. I have a question, and I it's just kind of in line with what Randy was saying.
Okay.
About like how do you come to people and thinking about people's predispositions, thinking about specific cultural issues, if you're talking to certain groups, but also for me, I feel like a lot of these, when you think about the anti-vax movement itself, kind of like an epidemic, right? Like even a pathogen. Some of it can come from I'm just reluctant. I just don't know about it. I'm concerned, and I'm a little worried, and maybe I'll just be inactive about it. I just won't do anything. But do you feel like you see for other people, or maybe it's affecting everybody, just the, I worry, like, how much is it anti-vax is just this thing that just happens, and how much of it is, coming from, individual people pushing misinformation. Like there are, some sources for, there's like particular studies that have been debunked, particular, like a YouTube video that goes around and all of a sudden everybody watches the pandemic thing or the whatever. Ugh. And there's like particular sources. It's not, it's not as simple as people just don't know any better. For a lot of people it's true, but then there's also that like people are actively being fed misinformation, and I wonder how much, what do you feel like is there a way to fight that specifically beyond just you want to give people the information for sure, but like beyond that?
That's a great question. I feel like it's really, besides the greed and callousness of capitalism, that disinformation is like the worst part of this pandemic. It is, like you said, almost like another virus that's just rampant. And I feel like it's another part of that chickens coming to roost, scenario, because again, like, this is the way that we constructed the world, that there would, like, that education would be this gateway to privilege, and that over time, as the pursuit of money has surpassed the pursuit of knowledge and prestige, like, you land in the world that we now inhabit, so the first problem is that educational access is restricted from so many poor people for no good reason. That's the biggest problem. And then, the second problem is that with all of those nutcases on YouTube, it's just, in this age of just, social media, it's brilliant for us because we get to stay connected, during this time, but it's just so impossible to unring some bells, you know what I mean? And one thing that I think we have thought about working towards is being more proactive with how we not just communicate the message, but like train other people to communicate the message. Because what we're seeing is that a lot of those people whose minds were changed, or a lot of the people who, just kind of want to make sure their people have information, they're able to start sort of passing along some of these like simple explanations that we've been giving. And so we want to see if we can find a way to kind of amplify that a little bit more so that the ripples just extend a little further. There's some things that we're trying to plan now on the ground in several states. And I think, like you said, it's very particular to different communities, and there's different challenges for each, because if you're a person of color in this world, depending on where you are on that spectrum, your challenges are a lot different. So we've had to think about very carefully about the communities that we work with, and like make sure that we understand people's hurdles to getting, to that understanding. And then we start from there.
I really want to make sure that we highlight what Dr. Hudson is saying right here, because, and this is in the Facebook chat too, from, I believe, one of our Hood Medicine Initiative folks, who points out that there's a very big difference in motivation between people who are anti-vaxxer because of whatever propaganda that they have seen in whatever, Q adjacent circles, versus people who are distrustful of vaccines due to real historical injustices that were perpetrated upon their ancestors. And, as we've talked about on the stream before, the testing that was done in the military, and there are real reasons in these communities to be suspicious of something like this. So it is a different hurdle. Well, Dolio froze, but I'm sure he'll be back any second, because he was about to. That always happens when you're about to say something super important. That's when the call drops. That's when the Zoom freezes.
Oh, sorry. It gets addressed as though some sort of a cultural disdain for vaccines and whatnot, but it's not necessarily a cultural thing. It's basically just a reaction. It's a distrust that developed through not only historical mistreatment by a for-profit medical system, but also contemporary mistreatment. We can always reach back to, dubious experiments and, things that would be nowadays categorized as outright torture.
But also,
we can also point to things that are happening now. you know, and a lot of it has to do with, you know, because of the separation between access, not just access to the medical care, but also access to the education that would put you in a position to be able to be a provider. It puts you at greater risk when you don't have, unfortunately, if you don't have a healthcare provider that shares similar concerns as you, the likelihood that they will be less careful is increased. What was I can't remember what the exact statistic was of a baby that is delivered by a black baby that is delivered by a black doctor has, I believe it has twice.
I think it's 3 times.
Yeah, 3 times.
Yeah.
3 times more likely to survive.
Yeah, it's a horrifying stat, and I was thinking about that.
Then it's delivered by a non-black doctor.
And just like you look at the stats, and you look at things like when you look at the overall statistic about like infant mortality, and you're like, okay, your child has this chance of surviving and this chance of dying. Okay, but you know, if your kid is white, that number, that's a different number. That's a very different number.
And it's not that these babies are less viable.
No.
It's just, you know, they get doctors and nurses and healthcare professionals that actually don't care if they live or die.
I think it's important to also point out the nuance there. It is totally about access to care, and also about the way that, you know, the pitifully few touch points that people have with the system. You know, I think public health people talk a lot about emergency room overuse and things like that being more, you know, preponderant in minority communities. But that's because, once again, we restrict preventative care access to poor people.
Right.
So these people don't have a continuum of care. They see whoever's ever at the clinic, whoever's in the ER. They don't have a trusted doctor they go to every year, every checkup. You know what I mean? That's not happening for those people.
Yeah,
period.
Yeah, because what would be looked at as a throwaway copay for those who aren't in that financial situation, that copay would be their groceries for the week.
Right.
Yeah.
Or if it's even a copay, if you even have insurance at all. If you're going into one of these urgent
if they even
care
have the insurance at all.
clinics without insurance, you're talking easily $175.
Right.
It's even more insidious than that, because the pharmaceutical companies play a huge role in it too. The way that works with Medicare, Medicaid, because a lot of, like, for example, you know, a lot of drug companies obviously relentlessly pursue doctors' offices. And a lot of their efforts around that has to do with, like, patient education. They want patients to have brochures about their drugs and understand how they work, and there's billboards in those neighborhoods and all kinds of stuff. It doesn't happen in Black and brown neighborhoods because they don't bother because they only get to have generic drugs, so they don't care about them. So they don't get that. They didn't even get, like, the piece of, like, understanding their drugs either. They get whatever's given to them whenever they show up, and then, you know, and then we kind of wonder, you know, there should be no wonder, honestly. I mean, we're all could be walking time bombs, you know, walking around with untreated medical symptoms, and then, you know, go in the hospital one day and just drop dead, you know. And then the people that are close to you might, you know, like, you know, people kind of, you know, we start to have these notions, like, you know somebody that went in the hospital one day and was fine and went in and never came back out, you know, but not realizing that that's because they have had a lack of care for so long, you know, that they didn't know until they got to the ER that night. It was a problem, you know.
That pharmaceutical disparity, as far as the understanding of, you know, things like drug interactions, has come up in this COVID-19 discussion before, because the obviously we know that in Black and brown communities, diabetes is a serious problem, which comes from also the lack of preventative care, and also poverty issues and all kinds of things that are creating that. But and historically, obviously, and the most commonly prescribed diabetes drug, I want to say, and please correct my pronunciation if I've got this wrong, metformin, I believe it is, has a very, very bad cross reaction with hydroxychloroquine and the other drug that they were saying to take hydroxychloroquine with, which I'm blanking on at the moment. But basically, if you took those three drugs together, there was a very high chance that you would die. And and that's exactly the kind of information that wasn't out there when hydroxychloroquine and its co-conspirators were being irresponsibly advertised by people in power. So yeah, it's a very wide-ranging problem that you're describing.
Yeah. It's in high relief now, if nothing else. I mean, it should be obvious to everyone what the issues are.
Yeah, I mean, that's one of the reasons why hood medicine is leaning heavier on scientists rather than medical practitioners, because of the distrust of the healthcare system. Because it's harder to inject bias and prejudice into the actual research. You start fiddling around with the numbers, you no longer have a career.
That's an excellent point. Can I throw something at you, Dr. Hudson, about something that's going on in Baltimore? That is a thing that they're trying to address the disparity issue as far as the vaccination rollout.
Sure, yeah, I'd love to hear it. Should I take notes?
Maybe. It's pretty simple, pretty straightforward. So Baltimore County rolled out their vaccinations about a little more than a month and a half ago, basically as soon as they could. And they've been getting, frontline healthcare workers, just like everybody, right, had the top priority, and they were doing it at the state fairgrounds, which is in Baltimore County. So a sort of open air but covered place where they could have a lot of people coming in and out, but, with enough ventilation and all of that it would be a safe place to do it. And they are now opening additional vaccination centers, and at least one of them is in a neighborhood where very much the surrounds are Black and brown communities, and their initiative there is actually to get the clergy vaccinated first. They're calling in the clergy from those areas, and basically hoping that what they will do and what they're encouraging them to do is to get the vaccination and go up in front of their congregations and basically say, I got it, I'm protected, let's get you protected too. So curious what you think about that approach, as it's not handing them the scientific information as might be the ideal way to do it, but trying to get past some of the distrust.
I mean, that's certainly sort of in the scope of our plans, in terms of, there's so many different touch points in the community that are important to engage, because Black people are not a monolith. So, obviously for a lot of us, the church is an important institution. I love that they're doing the state fair thing. That's brilliant. I hope that that's effective. I think we just attended a seminar last week with the MLK visiting professor at MIT's Dr. Charles Centeo, and he was talking about some of the research that they did to try to understand the reticence in these populations so that they can develop interventions. And they found that people had a lot more trust in Dr. Fauci, for example, than in seeing this latest sort of wave of sort of Black people demonstrating themselves getting vaccinated. And it sounds curious, right? I guess, but I honestly take from it kind of what we intuitively have seen also is that like we are not going to be able to overcome everything you and Dolio just described about the history and the contemporary historical and contemporary issues that inform that reticence. You're not going to be able to get through that with an Instagram story. You feel me? Like, if we don't talk about it, if we don't like literally address it and then explain the science and then be like, see why you need it now? Like, I want to be clear because I think it's important that people do it. I'm not saying I don't think they should do it. I just don't think we should do only that. I think if the clergy doesn't also explain something about the virus and why we need vaccination. We talked to Dr. Eric Yancey in one of our chats. He's a pediatrician recently. And, he kind of got into that a little bit. And he was talking about, first of all, he was kind of talking about, people sort of wanting to understand. He says that in his exam room, like there are people who come at him with like all manners of craziness about why they don't want to vaccinate their children or whatever. And at the end of the day, he's always just like, okay, well, either whoever you heard from on YouTube knows better than me after I've been treating children for the past 40 years, or I'm lying to you. You know what I mean? Like, and he kind of, he kind of got into a little bit about how he finds the most success when he tries to explain. He disarms people by asking them, am I lying to you then? Like, you know what I mean? But then he got into a little bit about like the story about the angel of death in the Old Testament. And he was just like, he was just, describing the story about how, the people were told to put the blood on their door if they wanted their firstborns to be saved. You know what I mean? And he was just like, you think those people back then were just like, I'm not gonna be doing all that putting blood on my door. I don't know. You know what I mean? Like, he was just like, if God told you to put the blood on the door to save your firstborn, then that's what you need to do. You know what I'm saying? And if you don't do that and you lose your firstborn, then that's up to you. You know what I mean? Because at the end of the day, for people who believe that in God, I would hope that you would understand that, God wants you to use your one life to do something, for one, but certainly to protect it, to not just throw it away, to not just figure, I'm not going to wear my mask. I'm going to go ahead and get on this airplane and go on vacation. You know what I mean? Like, I guarantee you he didn't mean for you to throw that one life he gave you away just because you don't feel like being inconvenienced. You know what I mean? And I'm talking to the people with choices. Trust me, my anger is not for the people who don't have choices in this world. But yeah, I mean, I think that can be really powerful if they're also equipped to message about, like, I know you guys are like hesitant, but this is an existential crisis. Do you know what I mean? We're talking about extinction level. Keep playing. I haven't even gotten to the Brazil mutant. That's only the first 3. You feel me? Like, it's only been a year. Keep playing.
Yeah, a year since all of humanity was first introduced to this virus. Like rhinoviruses, other coronaviruses, we've had those for millennia.
I clicked on the map today. 100 million people have been infected out of that 7.8 billion. So that's 101 million times 37.2 trillion, approximately.
Right. And we've had well over 2 million deaths from it worldwide, and that's an undercount.
Totally.
So it's huge amount of undercount. And the crazy thing is that's still such a tiny proportion of the population, which is why what Dr. Hudson is saying is so important, because even though we are kind of, past the point of no return, we still can protect ourselves and try
Certainly.
to
No,
make,
yeah, I mean,
Yeah.
I'm sorry. Let me be clear about
Please.
that. We are past the point of we're not past the point of no return in terms of if we all go out and get vaccinated. If you guys want to pretend that you understand that the world might end, like if you keep going to the damn club, you know, like if we write the course, if we all go get vaccinated, we might have a chance, you know, because like if we get the vaccinations give you the protection to shut the virus down. Okay, right now y'all keep giving it hosts. You're giving it unlimited chances to learn everything about us so that it can mutate to evade everything. That's one of the reasons why the Brazil mutant is so troubling, because first of all, just the rapidness of how it's spreading. It emerged, and 1 month later, like 75% of the people had it. But the thing is that the people that had it, 75% of the population had already been infected, if you can imagine. Like the way, how crowded the cities are. It's, you know, like 75% of the people had already been infected last year. And so the thing is that obviously that signals to them that this variant has found a way to change itself in a way that isn't responding to any, you know, of any of the immunity those people might have built up to it, which may have been fleeting anyway. And I guess, you know, now that they are starting to see it like spreading like wildfire down there, and it's in Minnesota now, here as well. And so that's the biggest, like, I guess, issue with it, is that it's just, if it's mutating to become more infectious and also to, you know, become more evasive, but not just evasive, but clever. Do you know what I mean? Because one of the reasons why it is more infectious, incidentally, is because, you know, it finds a way to like lay low, as Dr. Yancey would say. You know what I mean? It finds ways to, like some of the new variants in the UK and other places, for example, like they're saying that people aren't reporting the same symptoms. They're not getting those high fevers. You know what I'm saying? So it takes longer for people to get sick because it's laying low.
So they're just spreading it.
Rolling around, doing your thing, chilling. You're on the plane, weren't you? You're on the plane. And so it takes longer for those people to get sick. And so it's easier for it to spread in that way because we won't do the right thing. And so I guess that's what I'm saying. Like, you know, I feel like I was just here a month ago, and it's almost like, like the Lord of the Rings when Gandalf is like, you know, I come back to you at the turn of the tide. Like, it's only been a month, and I've already abandoned all hope, because what is going to change? The people ain't going to change. The systems ain't going to change. The government, what's the government going to do? Nothing. I mean, I don't know. We're trying our best to get people vaccinated and to make sure that we can put things in the place on the ground for people to get vaccinated. But when I see things like, you know, all the first world countries banding together to refuse, you know, special patent exemptions to like all of the poor countries who want to be able to produce vaccines. I mean, you know what that is. We know what that is. I mean, that's what we're past the point of no return on, because those people, in their mind, I think, who cares about them? We'll let them die. But it's not just going to be them.
Nope.
Period. That's the thing. Like that's the thing about the virus of greed and capitalism and evil, is that it's blinding. It makes you defenseless. You know what I mean? And your rationale, because I mean, you cut your whole nose off to spite your face. You know what I'm saying? As we can see here in this country, but like, not just that, but you know, they're so far gone that in their minds, they're really thinking, we're not giving those, what do they call them, shithole countries, notice? We're giving those shithole countries access to the vaccine when we can make money off of it. Who cares about them? Never, ever, ever realizing that those particles are invisible, baby. I mean, that's the point of no return that we're past. Is that what is going to change in the way that we exist in society that would turn the corner? I don't know that we're.
Excuse me, then, could invisible particles get around a wall?
Yes, and I know that sounds weird because Trump always said that if you just close your apartment door and like spray your hairspray, then the pollution won't get in the air.
Right, but if somebody sprays their hairspray in the kitchen below my kitchen, I will smell that. If they're cooking something in the kitchen below my kitchen, I will smell that, which tells you that not necessarily that they're going through the walls, but that there are mechanisms for air transfer between.
It's so ridiculous. Like even here, like I don't even have to talk about places where we don't see and we don't care about their suffering. Even here, people are so far gone in how much they disregard the lives of others. That even here, people just figure, we'll just let them get it. They can drop dead. I don't care about them. I don't care about the immigrants. I don't care about the black people. Who cares about them? Never once does it come back around and think, but you know what? If they get it and we all together, I don't know. Like, I don't understand what the disconnect is. It's like greed is a hell of a drug. I don't know. I'm not sure what it is. I mean, it's just white supremacy in general, but it's a doozy. And so I don't know how to combat that.
It's sickness unto itself, and that is terminal.
And seemingly incurable. So I wish I had. It can't get no more bleak. I mean, it can get more bleak, and it will. I promise you. But I have nothing happy to say. I implore everyone to get vaccinated. Damn the jokes. I'm not even in the mood. Like, if we don't do this, that's it.
I'm hopeful that there is a pendulum swing. That's the one thing that gives me any hope, that it could get bad enough that people realize we do actually all have to look out for each other, because even if you look at it from a self-interest point of view, if you don't look out for each other, eventually it comes back to bite you. So
I just want us to get to a point to where we can actually have this first wave crest.
Yeah. And we're so not there yet. Like, have you been watching the daily US deaths numbers? And remember, these are still under reportings. Like, we're closing in on 500,000, and like really fast. Like right now the numbers really around 450, but it's we're losing 2,500 to 4,000 people, more than 4,000 people a day. So that number is going to hit 500,000 real fast.
We're on average having a 9/11 every day.
Yeah, more than 9/11 was like 2,600 people, and like multiple airliners falling. If multiple airliners were falling out of the sky, people would be freaking out. But instead,
it's just because of the fact that it's the people who are the most vulnerable, who are by and large the ones who are falling, short of the ability to fight this off. That people just overlook it, but it is still affecting people who you don't expect. They are young people,
young healthy people,
rich people. This will happen to you too.
That's right.
Like the flip side of our slogan of "We all do better when we all do better." It's like, if anybody's doing worse, we're all doing worse.
Yes.
I guess is another version of the old Vidal Sassoon slogan. You don't look good. We don't look good.
I was totally thinking
that
we
was
were
from
going
the
to
archives.
That was a deep cut.
Right there. You know what I mean.
I'm so glad that's no longer the standard of beautiful hair.
What Vidal Sassoon?
Yeah, I would have to brush my hair so much more often.
I probably shouldn't reveal that.
We can. Is it something you can reveal in the after party?
Well, Yeah, I'll reveal. Just remind me. It has to do with Vidal Sassoon.
Oh, no.
Okay, we're making notes for the after party. This is the part for those who haven't.
We got an awesome fan that's in the chat, Quiet Horse 80, Nolly, that just wanted to give some encouragement to tell the doc to not give up fighting ignorance.
Seconded by
never.
Rusty.
Nah, we're not gonna let it.
Never. It's dismal. It's dismal because my like statistician mind is like looking over the horizon and it don't look good. But we're gonna do what it do until then. We're gonna try to tell as many people as possible because nobody else is doing it. Like, and I need people to take it a little more seriously.
Yeah, spread the
It's easy to get
word.
really disheartened looking at the numbers and the stats and.
Yeah.
Yeah, Dolio's been seeing a lot of these stats. The one that's getting me is that, what did they say? The guess is that 17% of the U.S. population, if that, has been infected, which means that we are at 500,000 deaths because of the undercounting of last year was at least 100,000. So we are at 500,000 deaths from this, and that's with less than 20% of the population having been infected. So
Right.
you don't need to be a statistician to do the math on that.
Right.
One.
That's crazy. I did want to kind of maybe get into a little bit about the vaccinations because I know in a lot of places they're starting to roll out, and in a lot of places it's a complete cluster. I know I had to help a lot of my elders register, and it's not a pleasant experience. It's like trying to get a hold of the cable company on a Friday afternoon. I know because at least like for in Indiana, there's like a link, but then I swear every single person, had the same issue with like entering their birth date and clicking a few of the other options. And some of these like kind of make you wait, almost like you would for like a chat help on a website or something. So you have to like sit there and wait for 45 minutes until someone comes on to get you an appointment scheduled.
No.
Unfortunately, a lot of people just kind of give up, right? Because
that's what I'm doing. It's like just trying to schedule these appointments and stuff. It's like huge wait times, or this like weird system where you have to be on the site and you have to keep like scrolling and refreshing.
Yes.
So like opening comes up and you're there right the minute to get it.
Getting concert tickets.
They could not have made it more complicated.
Yeah.
In any way, especially to be starting with the elderly.
Right. Okay, everybody who's over 75, first you get online.
Download this app. It's too much. But I did want to say a few things. Like obviously you can go to the CDC's website. You can go to your state health department website. You can go to hoodmedicine.org and just click on this info on where you can get tested and vaccinated. And a lot of the intake forms or the registration forms I'm hearing also ask for your healthcare information if you have it. And that maybe has been like deterring some people, or at least confusing them or whatever, and kind of, or maybe, truly deterring them when they see it, because it hasn't been made explicitly clear that the vaccines are totally free. You know what I mean? Like, if you don't have insurance or you are underinsured or whatever, it's free. But people who do have insurance, right. So there are two classes of people in this society. I just wanted to reiterate before I continue. Those who don't deserve health care, apparently, and those that do. So those that do deserve it, their health care pays for the vaccination. And so that's why they collect that information for people who do have health care, because it's still free to you, but it gets billed to your health, to your insurance company if you have insurance. If you don't, it's still free. So you can just bypass the health insurance information if you don't have it. It won't reject you if you do that.
And I think the same goes for the take-home tests.
Mm-hmm. Yes, you're right. Yes, the testing should be free as well. And people, there's places like CVS and Rite Aid, and there's lots of places that are doing it for free, like drive-through testing and stuff like that. And then otherwise, you can go through your healthcare provider to be directed to somewhere if you have, a primary care provider. if you don't, it is free, and there's lots of different places where you can get tested. But yeah, so those are some of the sort of feedback I've gotten from people who've taken it so far. I think everyone's reported back that, you know, when you go to have your first dose, they, you know, kind of hold you for 15, 20 minutes to make sure you don't have any adverse reactions. And then they give you, this is an important part too, especially for older people or people who don't have a lot of technological access. But like before you leave, they'll schedule you for your second dose, but they also issue like a card, and it has like all of your ID info on it, the date that you got the vaccine, and it tells you which vaccine you got and the lot number, everything. So that but it's almost like literally a passport. That's how important that card is. So what they've been doing is telling people if they have the ability to take a picture of it and keep it on your phone just in case you don't lose it, because it's like they literally cannot administer you a second dose if you can't prove that you got the first one. Do you know what I mean?
Right, and they're supposed to have the records, but still.
Yeah, they should have the record.
Better for you to have your own record.
I've been hearing that a couple places have been, you know, they're requiring this card, like a passport almost. So, I don't know if that makes it easier. I mean, I know they have to track it somehow, obviously, but it just seems like there's got to be an easier way to do some of these things. And then I think for the most part, I mean, I haven't heard of any other sort of hiccups or anything. But in most states right now, you know, they're still on the first couple tiers, which is like the healthcare workers and first responders, essential workers like sanitation workers, public safety, transportation.
Teachers in some places.
And then the elderly and people who have pre-existing conditions, who are able to get it. So they probably will not be moving on for. I know they have plans to roll out the next couple tiers, but I know there's also been some issues with supply, and so I don't know what that's going to look like over the next couple months. But so far, it seems like it's been slow going and a bureaucratic nightmare. So that's kind of one of our other focuses right now, is trying to find ways to make things easier for people in terms of getting them registered and helping people get to vaccination places. We have a couple of our members who are working on like organizing buses and transportation for people who can't get to vaccination, and hopefully down the line getting some mobile vaccination units together for different places where people have a little less access geographically. So yeah, we're not doing that great so far. Of course, Biden just took over, so fingers crossed.
Yeah, a lot can be done on the federal level that where before, you know, it's all efforts of not just efforts of the states, but efforts of individual counties and cities and towns. I mean, it's so diffuse, which is why what you're saying about some places requiring the card, some places not necessarily having the records all together. It's not surprising because there's so many moving parts to this whole thing. I mean, you have people who have never had to coordinate such a massive scale enterprise who are having to deal with everything from the computer administration of it and registering people for appointments all the way to, you know, the cold chain and making sure that the vaccines are staying viable from start to finish. It's a lot for a lot of people to handle.
In the whole shell game regarding the plan earlier was not a help.
The what? The what now?
The whole shell game regarding a plan earlier was not a help.
Oh yeah, no. I mean, it cannot be overstated that, you know, Trump and all of the Republican cronies and all the rest of them won't stand up to them are solely responsible for the depth of this crisis. Like we shouldn't be here.
Yeah.
We wouldn't be if we had had competent leadership over the last, I don't know, 14 months.
Yeah, and you can see that in the numbers. If you look at the worldwide COVID deaths numbers, like, would we have had deaths? Yes, we would have had deaths. Would we have had 500,000 inside less than a year? No. We absolutely
would anybody have had to go into the emergency room after drinking bleach? No. You feel me? Like, I don't know how to combat that. You know what I mean? I don't know what kind of ignorance that is. You feel me? I don't know what to do about that. But
I will bite my tongue.
Yeah.
I
Indeed.
have my thoughts about it, but
Indeed.
it will offend people.
It will. It will. But speaking of mutations, back to the Brazil.
Wait, before we jump off that, can we talk just a little bit more about the vaccination rollout? And so because this leads directly back to what you were talking about before about how the vaccines work, one of the things that seems really interesting and unsurprising is that people on the second shot are much more likely to report side effects, particularly COVID-like side effects. And is what's happening there essentially kind of evidence that first shot worked, that it taught your immune system to recognize this
exactly
thing?
Yeah,
now
and then that
the
booster kind of kicked up the response in full gear. Yeah.
Cool.
The first time is just kind of the introduction. It's like, hey guys, check this out. But it's not uncommon for vaccines to require boosters, right? Like some require 3. So I mean, that second one is just that second wave to just be like, oh, that guy. Okay, we got it. Cool. Next time we cool. You know what I mean? So like that's kind of what happens with the booster.
Because the reaction is because those symptoms are basically your body creating the antibodies.
Yeah, I mean it's the same. It's the same concept of like how sometimes after you get the flu vaccine, you feel a little under the weather.
Yes.
Like your body is still going through the same process that it would physiologically if you had been naturally exposed to that antigen in many ways. So you'll feel that little bit of discomfort, but it just won't develop into illness because it'll get shut down.
Right.
So it's not always a benign process. Sometimes you are going to feel a little under the weather, but it doesn't mean that it's giving you COVID. It doesn't mean that like you're getting the illness. Vaccinations, even old school vaccinations that actually have like dead virus in the needle is not giving you the virus. It's just giving you little pieces as little ID cards, just little pieces of it so that your system is able to put it in a library, make little antibodies, put them in a little box, and then the next time they see that, next time you get infected, which you might, right? You might.
Yep.
The next time you see it, then you'll have what it needs. And then they'll be like, let me see that ID card, go get that one box. Bring the antibodies over here because, you know what I mean? So that's how that works. And so, I want to make sure that people understand that vaccines only teach your body to remember. I think a lot of people, we use the word protection so much and, and people almost, I think, kind of have like this weird sense that like the vaccine might be like this invisible bubble that prevents you from getting infected. And that's not the case. It prevents you from getting ill.
Yeah.
You know what I mean? It gives your body the information it needs to fight off whatever the disease is the next time you get it. So that the vaccine itself, its existence implies that you might get infected again, right?
It's like a child predator registry. It's like Chester the molester moving into your neighborhood, knocking on your door saying, "Hi, I'm required by law to inform everyone in this neighborhood that I moved here."
Yeah, but only if
I have a thing for touching kids.
But only if like then all the neighbors came through and like killed Chester like Freddy Krueger. Then
it lets you know
that would work.
What I'm saying is that it's letting everyone in that neighborhood know not to let Chester babysit their kids.
And if you see him, Take him to the
It's on
basement at the high
site.
school and burn him.
If you see him, it's on site. If you see him somehow in your house and he ain't supposed to be in your house, go get a shovel.
Right. But also there are trillions of Chesters. So
Right. Trillions
if
of
you just burn
Chesters.
the one of them, it's really...
Yeah.
Right.
So it's a difficult analogy, but we're rolling with you, D.
Right. It's letting you know that Chester runs with a crew.
Yes.
They all have this particular tattoo that says Chester.
Please don't
crew.
say.
Spike.
Please don't say what the tattoo is. Okay, good.
It's a spike.
Chester's
Let's
crew.
not.
It's just a spike.
Let's not say what the tattoo.
Metaphor only works so well.
Yeah.
So we definitely want to get into the Brazil variant. Do we want to take this to the Twitch at this point, or do we want to keep rolling? I'm happy to keep rolling on Facebook and YouTube because this is important information.
Yeah, sure.
Yeah, we can do it.
Yeah, it won't. I mean, it won't. It's not that much more. It's just.
Yeah, tell us. Educate us, Dr. Hudson.
So no, they're just really concerned about this one also being an escape variant. I think, I think they're concerned that maybe the antibodies that the population should have perhaps built up after it being endemic, because of the way that their society is set up. The fact that it spread so quickly means that whatever immunity people may have built up, whatever antibodies they may have had, may have lost, sensitivity. And that's troubling, that's the whole point of kind of imploring people to get vaccinated and to take it seriously, because the longer our population goes without getting vaccinated and the more we refuse to, use social distancing measures and wear masks properly and isolate ourselves when we can, the more chances it has to learn everything that it needs to know about our bodies and our immune systems. That means it gets to figure out how to hide out so that all those assassins that came to the party can't find it, even though they know it's there. You feel me? Or they send the antibodies to attach to it and they won't stick. So then they can't be cleared when the assassins come through to kill all the tag cells. The tags fall off. You know what I mean? Or even just the tags not being able to attach because they changed the spike protein so much that key don't fit in the lock no more. You know what I mean? So it's they're finding clever ways to get better. And it's almost like these are just sentinels almost, the fact that we don't have any control on the spread is what terrifies me, because it's only been a year. It has plenty more time and plenty more bodies to figure out more clever mutations and more interesting ways to help us into our grave. And it's troubling that not only that the spike proteins are being changed, because that means that we're constantly playing cat and mouse trying to figure out what the vaccine needs to be. Yeah. And as you can see, we're not going to be able to vaccinate people even in time. I mean, it's not going to work. We're not going to be able to vaccinate enough people to achieve herd immunity before it mutates another, 8-10 times? I don't know. And, just having that freedom, the fact that we keep giving it so many hosts to practice in, I mean, that's what scares me, because it accelerates its progress. I don't know how long it was in bats, but it probably took a while for it to be able to jump species. We're it's on the fast track, you know what I mean? Because of just the numbers. It has so many more opportunities than anything we've seen.
Yeah, the world has never been this populous.
Right.
And it's never been this interconnected.
Right.
Right. The bubonic plague wiped out most of Europe.
There were no airplanes then.
And there were no airplanes. There were people just traveling by boats. But that happened a lot due to a lot of cultural things that were happening there as well. There was separating society. You know, basically,
Yeah.
the different classes were set up such that only certain people of certain classes could hold professions in the medical field. And because of that assumption of their virtues, there were precautions that could have been taken that they did not take because they were assumed to always be quote unquote clean.
Yeah.
Maybe we would have discovered antibiotics sooner too.
Yeah, there was a lot of cross-contamination between, you know, handling of cadavers and delivering babies.
Yeah. Ugh. There's so much bacteria back then.
Hey, let's not try to vaccinate and fight it, right? I mean, yeah, we're only going to be able to do so much, but not to say, let's, you know, like it's hopeless to the point where. I know that's not what you're saying, but
it's not what I'm saying. I'm just saying I don't see what would change. But I mean, like I said, I don't know. Maybe they have a plan. Maybe he'll get serious and call in the military and get people vaccinated. I have no idea. But all I'm saying is at the rate we're going right now, I have no confidence in the rate we're going right now. But that doesn't mean that we're not going to like fight to the end to try to save as many people as we can. I mean,
you gotta get people to think of it in a more selfish way as a self-preservation method.
Yeah.
Because it's going to take that a huge cultural shift in getting people to actually give a damn.
Right.
In order to get to curb it. We've seen that approach. You know, we've seen that approach seem to reap results in other places that have a different culture as it pertains to like the society at large.
You mean like New Zealand?
Yeah, I mean they're more isolated. They're an island.
Yeah, that's true.
It's easier for them to shut things down. They also have state-sponsored healthcare.
Yeah, that too.
There's no barriers to entry when it comes to, you know, getting treatment.
Yeah.
And no profit motive for people to be sick.
Right.
And a prime minister.
Just in case that nobody else knows, the United States and Guam are the only places that, one, don't use metric and also have for-profit healthcare.
Wow.
Shout out to Jacinda.
Yeah.
Oh, sorry, and American Samoa.
Aren't American Samoa and Guam just our territories anyway?
Yes, which is why they don't use the metric system, nor do they have state-sponsored healthcare. But we can talk about that later because our government still subsidizes countries that have state-sponsored healthcare.
Ooh, all right, we're getting into a whole and we will have plenty to talk about on continuing Friday nights. It is now 11 o'clock.
That's right. Yeah. So we're going to move over to just the Twitch. That means Facebook folks and YouTube folks. Come to gangstagrass.tv.
Push some important information into your malleable brains.
Uh-oh. Wait, somebody says they have a case of...
Girl Scout cookies.
Wait, are we talking about real cookies?
Can I order? Do they have samosas, whatever they're called?
You can have all but the Samoas. Oh, I'm not the ingredients in the Girl Scout cookies. It's like very palm oil heavy. They leave like a film on my mouth. I can't do it. I can't do it.
Good film.
Yeah, I'm
also the child labor
kind of guy myself.
In that film.
I am abstaining from Girl Scout cookies this year, like I did most of last year. Because I have the problem is it is near impossible to not down an entire sleeve of those.
Period. Period.
So I realized that I have a Girl Scout cookie problem, especially when it comes to the Thin Mints. So it's better for me to abstain from the Thin Mints, else I sit and eat all the Thin Mints.
Yeah, that's the first step. Yeah.
That is the first step.
If only we could get the vaccinations into Thin Mints.
Probably OD on vaccine.
Let's wrap it up to help spread misinformation out there. Dr. Hudson, can you confirm? We're hearing a lot of people say this. We don't know if it's true. This is what we hear everybody saying, but does the vaccine contain gangstagrass?
That is what we've heard. There's strong evidence.
If it did, I'd be a lot more hopeful for our prospects.
We might be putting that in the vaccine.
Mm. I did hear it was coconut scented and mango flavored.
All right, with that, we will say that it has been awesome having another Friday night with Dr. Hudson.
As always. Thank you for having me.
In the house.
Sure. Wait, are we on? We're off of Facebook?
Not yet.
Oh,
We're saying goodnight to Facebook and YouTube, and then we'll go and remind you to tell us the Vidal Sassoon thing that we're saving.
Oh. Mwah.
Yes. Good night, Facebook.
All right.
All
Thank
right.
you.